Scientists warn that climate change is just one part of a broader environmental crisis with growing risks to global health and stability. Maisarah Faiesall, Head of Policy, Strategy and Advocacy in Sunway Centre for Planetary Health, tells us more about this.
It's really easy to focus solely on climate change because it's such a pressing issue and, rightfully so. But what the commentary really intends to drive home is that it's just one piece of a much larger puzzle. And the full story here is really about the stability and resilience of the entire Earth system. So in other words, the planetary boundaries framework that's referred to in the commentary and how human activity is pushing it to its limit. So put simply, if you read the commentary, there are 9 key processes that keep our planet stable. Climate change, of course, being one of them, but it also concerns about, for example, how land is being used, the levels of ocean acidification and novel entities like plastics or microplastics. And the scary part is that 6 of these 9 identified boundaries that sustain human well-being on the planet have already been breached, meaning that we've gone beyond safe operating levels. So in addition to that, we also have issues like biodiversity loss and such. So the reality is that we want to make people see and understand that for each of these disruptions, individually and in combination for each of the planetary boundaries, it also affects human health and our health from, infectious and zoonotic diseases similar to COVID-19 as we know it, but also in terms of nutrition, of like food that we get from the plants that we produce and such, as well as, of course, our mental health. So the full story is really not just about rising temperatures, it's about a systemic threat to our well-being, stemming from multiple environmental crises happening all at once as a result of our own actions and the ways that we've treated the planet that we depend on.
Maisarah also highlighted it's not just about understanding the crisis, but the key matter is about how we respond.
So what's interesting is that planetary health and planetary boundaries both are rooted in systems thinking and the need and urgency to break silos. So naturally, this alignment is meant to drive us to act more effectively, especially at a time when resources are constrained. I think maybe to summarize, first, of course, this alignment between planetary boundaries and planetary health enables a more systematic and comprehensive understanding of health impacts. We used to look at climate change and health or pollution and health in isolation. Now we can kind of conduct, full health risk assessments for each planetary boundary. And this also includes assessing the risks of tipping points where changes become irreversible. And of course, secondly, it's about bridging gaps in the scientific community. For too long also, Earth system scientists and health scientists often speak in different languages and maybe sometimes you even use different metrics. So this integration kind of demands a common approach in translating these complex environmental data into clear health outcomes and vice versa. But central to this, I think, is the role of justice and equity that's also highlighted in the commentary. And it's pushing for safe and just boundaries that recognizes how the current planetary crisis disproportionately impacts vulnerable populations. And finally, I think, as mentioned earlier, and so important for policy, is really making the invisible visible. What are maybe health co-benefits that we can get from protecting our planet, from investing in well-being economics in urban planning, for example. So this alignment really provides a stronger evidence-based argument for policies that protect nature and how they're often the most cost-efficient solutions in the long run.